Have you ever felt cold, numb fingers and toes? You might want to watch this video, which will give you a broad idea about Raynaud's phenomenon, its causes, symptoms, prevention, and remedies. This is Vishaka Poyrekar, a student from College of Home Science, Nirmala Niketan, CRM department. So let's begin with introducing Raynaud's phenomenon, also known as Raynaud's syndrome, Raynaud's disease, or circulation disorder. A condition in which areas of your body, such as fingers and toes, feel numb and cold in response to cold temperature or stress. The smaller arteries that supply blood to the skin become narrow, limiting blood flow to affected areas. There are two types of conditions, primary Raynaud's and secondary Raynaud's, which I'll explain further. I, as a student, would love to utilize my knowledge to help you understand the technicalities of the disease. Talking about which, let's move on to causes. Raynaud's is caused by peripheral blood vessels overreacting to cold. Raynaud's can start after injuries such as frostbite, a broken wrist, or a local surgery. Primary Raynaud's has an unknown cause, or we can say it occurs spontaneously. Secondary Raynaud's is one that comes from connective tissue disorder like lupus or some type of autoimmune condition. Exposure to cold, such as putting your hands in cold water or being in cold air, is the most likely trigger. For some people, emotional stress can trigger an episode too. Now, here, you should be most attentive as I am about to tell you how to assess yourself by looking at these signs and symptoms. Cold sensation can be felt in fingers and toes. During an attack of Raynaud's, affected areas of your skin usually first turn white, as you can see here. Then they often turn blue and feel cold and numb, as you can see here. As you warm up and your circulation improves, the affected areas may turn red, throb, tingle, or swell. Numb, prickly, or stinging pain upon warming can be felt during stress relief or when the blood circulation is returning back to the extremities. Color changes in your skin can be seen in response to cold or stress. Raynaud's most commonly affect the fingers and toes, but it can also affect other body parts such as nose, lips, ears, even nipples. After you warm up, the return of normal blood flow to the area can take 15 minutes. Some of the occupations which are at risk are certain jobs that causes repetitive trauma by repetitive movements and overuse. Jobs that require operating tools that vibrate, working in extreme cold climates. Now let's see how can we prevent it. Layer up yourself with warm clothes, shoes, hats, gloves, scarves before you go outside in cold climates to prevent cold air from reaching your body. Wear earmuffs, face mask if your earlobes and tip of the nose are sensitive to cold. Warm your car with heater before driving in cold weather. Wear socks while sleeping. See your doctor right away if you have a history of Raynaud's and developed a sore or infection in any of your affected fingers or toes. These are some of the remedies to alleviate, prevent, or avoid the disease. These may help in decreasing Raynaud's attack and help you feel better. Exercising will increase circulation, among other health benefits. Avoid smoking. Smoking or inhaling secondhand smoke causes skin temperature to drop by tightening blood vessels, which can lead to a Raynaud's attack. Soak hands in warm water at the first sign of an attack. Avoid rapid change in temperature. Try not to move from a hot environment to an air-conditioned room immediately. Control stress. Learn to recognize and avoid stressful situations which might help control the number of attacks. Avoid triggers such as certain medicines and stress under doctor's guidance. Here are some tips and tricks and exercise that might help you. To help boost blood circulation, do yoga, deep breathing exercises, legs up the wall exercise, squeezing a ball in hand. What can you do during an attack? Warm your hands, feet, or other affected areas. Wiggle your fingers and toes. Place hands under armpits. Make wide circles like windmills with your arms. Get indoors or to a warmer area. Massage your hands and feet. If stress triggers an attack, try to get out of the stressful situation and relax. Practice a stress relieving technique that works for you. And warm your hands or feet in water to help lessen the attack. Consult a rheumatologist or a doctor soon. Thank you for watching. Do share for your loved ones to learn something new as well.